Hi, beautiful people. How are you? I hope you're having a great day. So, we're back for part two of anxiety pain. It's the same day, wearing the same clothes. It just gave me a little bit of a break because now we're going to talk about emotional trauma. And this is your trigger warning. Some of the following content can be triggering. It triggered me, and why I don't cover this topic very often. I had to take frequent breaks when I was researching this. So if you proceed, please take the breaks that you need and find things that bring you happiness before returning to the topic. In a 2020 review of studies on emotional trauma and neurobiological events, shows that an emotional trauma may induce a cascade of neurobiological events that have long-lasting consequences and even altered gene expression. Repeated emotional stressors, even in the absence of post-traumatic stress disorder diagnosis, has been shown to produce increased synapse formation and dendritic growth in the basolateral amygdala, dendritic retraction in the hippocampus, and anxiety-like behavior against specific triggers, such as a phobia of being in open spaces. The brain is a powerful thing, isn't it? Wow. Neuroimaging studies of the brain have confirmed this, as well as activation of the anterior insula, which records the physical impact of negative emotions, and the anterior and medial temporal cortex, which are involved in negative emotions. Other areas of the brain are also affected by PTSD. There's no getting around the effect of trauma on the brain. Trauma creates a sequence of neurobiological responses that can affect brain structures, change neurobiological synapses, and potentially alter gene expression. It's not our fault, beautiful people, and we're okay. Pain in fibromyalgia may change central nervous system communication. Our altered neural pathways may skew pain perception and contribute to other regularly seen symptoms such as cognitive impairment, sleep disturbance, and fatigue. The following examples of trauma can lead to PTSD: being involved in or witnessing a serious car accident. Yes. Fighting in or living through war. Thank you for serving. Violent assault. Bless you. Surviving a fire, flood, hurricane, or other disaster. I'm so sorry you went through that. Death of a loved one. Yes. Childbirth experiences. Yes. Abuse. Gentle hugs to you. Although fibromyalgia isn't exclusively related to childhood or adult trauma, it is known that traumatic events in childhood may be linked to fibro. In a 2020 large-scale study, which followed a 2018 small-scale study, researchers in the large-scale UK study stated 80,657 adult patients who experienced childhood maltreatment or maltreatment-related concerns were matched to 161,314 unexposed patients by age and sex. That was a huge study. They looked at the development of disorders such as fibro, chronic fatigue, TMJ, chronic low back pain, chronic headache, myofascial pain syndrome, and restless leg syndrome, as well as interstitial cystitis, vulvodynia, chronic prostatitis, and IBS. Researchers found that patients who experienced maltreatment developed the following: fibromyalgia, chronic fatigue syndrome, chronic lower back pain, restless leg syndrome, and IBS when compared to the unexposed group. This was 2.06 times higher risk of developing fibro later in life. Wow. But the following were not statistically significant to develop due to maltreatment: chronic headache, TMJ, interstitial cystitis, vulvodynia, chronic prostatitis, and myofascial syndrome. Interesting. Those conditions, as we have discovered from a few past videos, are commonly found in fibro patients. So, is it anxiety pain? Chest pain is a common symptom of anxiety and panic attacks, are they not? I think we can all agree with that. Obviously, chest pain isn't always from anxiety and panic attacks. There can be other biological reasons for that, but it doesn't disregard the fact if you're having chest pain because of anxiety that it isn't real, because it is. When our stress is high, anxiety is high, and pain increases. It can be a vicious cycle, but many chronic pain disorders are common in people with anxiety disorders. Those chronic pain disorders are arthritis, which is a musculoskeletal disorder that affects the joints. Pain, stiffness, inflammation, and damage to joint cartilage and surrounding structures are symptoms. Suddenly, along with an increase in fibro symptoms, my arthritis pain has gotten worse in the last few months. I mean, it's kind of shocked me a bit, to be honest. Anxiety, depression, and other mood disorders are common among people who have arthritis. I'll talk about what's going on with me in a moment. Another chronic pain condition is fibromyalgia, obviously. Yes, yes, yes. Migraine is a severe pain felt on one or both sides of the head, a former issue with me. Back pain is more common in people with anxiety and mood disorders than those without them, but illness, accidents, and infections can also cause back pain. When preparing for my first defense, I've told you all about this for my dissertation, I got the worst back pain ever. I didn't do anything to injure my back, but a clear injury was shown on my back scans. And at that time, I could barely move. I could barely get up and down out of a chair. And it was all stress related, anxiety related, more like it. I mean, stress leads to anxiety. And let's not forget about chronic fatigue syndrome, restless leg syndrome, and IBS. Just remember that people under stress experience mental and physical symptoms such as irritability, anger, fatigue, muscle pain, digestive problems, and difficulty sleeping. All fibro symptoms, and why fibro is often called an overactive stress response. Anxiety, on the other hand, is defined by persistent excessive worries that don't go away even in the absence of a stressor. Anxiety will lead to nearly the same symptoms as stress. They are insomnia, difficulty concentrating, fatigue, muscle tension, and irritability. Treating anxiety and fibro or other chronic pain condition can be difficult, but not impossible. It's important to be open to new possibilities and share openly with your physician or psychologist. These are the treatment options that are widely available. For most of us, we'll do many of these at the same time, especially when we're anxious. Medications, that's usually the first line of treatment if you're seeing a physician or psychiatrist. Work with your doctor. Normally, an SSRI or MAOI is needed. These medications should only be taken on the short term or when you're overwhelmed with stress or anxiety, but then for only the short term. CBT or cognitive behavioral therapy is a common psychological treatment. Breathing training, progressive muscle relaxation, and exercise are common techniques. You'll learn to manage stress that contributes to anxiety and pain. This is usually the much preferred treatment by physicians. There are relaxation techniques. I've mentioned this many times in my early videos. Complementary and alternative treatments such as yoga, acupuncture, and massage are very helpful. We're all different. I love massage, but I don't like yoga. So, we're all different. Do what works for you. And of course, a mental health professional may be just what you need. Lifestyle changes and things like exercise, a better sleep routine, and nutritional help may be needed. But here I go again. For me, for example, when I was preparing for my first defense, it was a short-term issue. Once my defense was over, I was free to work on the pain. The back pain, which was minimal prior to the stress, became excruciating. It took medication and physical therapy for me to get on the right track. My current issue, what I'm dealing with right now, of being reminded daily that I have an impending loss of vision, can be horrific at times. But as I said, I try not to think about it. Excessive worry is going to do me no good. However, a friend prayed for me and said, God wants to heal me and to stop saying that I'm losing my vision. I felt a little bit traumatized, to be honest, by that. And so I spoke to my oldest son, who's a pastor. We agreed that she was well-meaning. She loves me. I love her. She's amazing. But I just felt off by it. I do and will always have full faith in the God I serve, that He will heal me. He loves me beyond measure, and He loves you too. But I'm not going to just sit around and wait on God to heal me. I've got to live my life. Otherwise, I can be miserable because God will choose when it's time for me to be healed. That said, I'm open and willing to be healed. I pray for it. At the same time, I am aware that He may not choose to heal me while I'm on this earth. It may occur after I pass from this life to my new life in the presence of God, and He gives me a new body, new eyes, and that'll be fine and wonderful and glorious. My God is a good God and full of compassion. And it may be that I must cope with blindness along with fibromyalgia. So I'm working on acceptance. In the meantime, I serve my God and choose to love mankind. And you, beautiful people, thank you for listening to me always. It really matters. And I think I need this time sharing with you. All of that was to explain why my pain has increased, why I had to up my medication. Stress and anxiety are our enemies, and they do nothing to help us. I've lived with fibromyalgia since 2008, and Not one time has my doctor's office given me an application for a permanent disability plaque for my car that will allow me to park in the handicap parking. It's just at this point a plaque that you just hook up over your visor. On my last doctor's visit, they gave me the paperwork to fill out, and it sat here on my desk for, oh, probably 4 or 5 days because the print was really tiny. But I used my wonderful light I have up here. Watch, see how bright it gets. And I put my paper under here, wore my number 4 magnifying glasses, reader glasses, and filled it out all on my own. I was proud of myself. I mean, I'm aware that time is not on my side with geographic atrophy. It's why I'm getting the shots in my eyes. So far, I've had 2 shots in my left eye and 2 shots in my right eye. My vision, I don't know. I guess it's slowed down from where it was headed. I can't recall. I think I shared with you all that I went from 2100 vision the last visit to 2200 in my left eye, and from 2050 to 2060 in my right eye. So that one is, my right eye is degenerating at a slow rate, which is really bizarre because down here on the lower right side is where the damage was done from a lack of oxygen to my optic nerve, and I can't see out of this part down here. And all that was due to having sleep apnea. Who knew? But, you know, it's slowing down a little, but still progressing. I just need to get a grip on my anxiety. I don't like taking meds for it because there really isn't anything out there that isn't addictive. I've never been addicted to any drugs or medication before. I just don't want to start. I'm still young enough that it concerns me. But, if I can't get a grip on it, that might be the course. I'm doing the other things to help me. So I just wanted to share all of that with you. I hope you don't mind. So, does all of this make sense? I mean, any one of us can become anxious over what might not seem like a big deal to another person, but to you, it's a big deal. And so we love and hug each other as much as possible as we go through this life and the things that we have to work through. So I hope you learned something. I send you gentle hugs and support. Love you. I'm just making my goofy faces for my picture. Okay. I just finished just now. That even makes sense. Oh, okay. Fiber is end of Kurt. God will choose when it's his time. Teeth. Oh.